So, want to talk about depression, and you know why. All of the things that have been going on in our world. So, I want to formally introduce myself. I'm Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakana, one of the co-founders. And I want to thank you for being so patient with me. I've been surgery all day, in and out of surgery, not surgery on me, but me doing surgery on other people. That always gets people. They're like, oh my God, you were in surgery? But I'm a surgeon. I'm a female surgeon, right? An obstetrician gynecologist, and really wanted to talk about depression, anxiety, mental wellness, mental illness, because there's just a lot going on in our community. And all of the things that are happening are affecting us. You know, the killings, the shootings that happened in Texas, that happened in Buffalo, New York, the list goes on and on and on. And we absolutely have to manage our stress. We have to manage our anxiety. Some people manage it different ways. You know, I manage my stress and anxiety by working out. I work out every day, sometimes 2 or 3 times a day if I'm teaching. Some people manage stress with yoga or Pilates. I also manage my stress with prayer, meditation. Some people manage stress with alcohol and drugs and sex. Some people manage stress with a lot of antipsychotic medications or therapists. But here at Wakana, we absolutely have products that can really help all of us and our loved ones during this time that there's a lot of unrest in our world. And so that's why I wanted to bring up this topic this evening. I'm a mom of 3 incredible children. In fact, I'm going to be a grandma soon. For the first time in my life, my oldest son is going to bless me with a baby. I don't even care if it's a girl or a boy. Don't even care. I'm just happy to be a grandma. November 24th is their due date. And then my 26-year-old Joshua and the baby girl Hannah, all 3 are off of my payroll except one. My daughter's going to medical school. She starts the end of this summer. That's why I won't be in Jamaica, because I'll be moving her and getting her prepared for medical school. So excited about that. I am a surgeon, as I stated, an OB-GYN of over 30 years, and really have been interested in holistic ways of addressing health in my patients. I've always been interested in herbs and different modalities other than traditional medication and surgery for my patients. So when Melissa Boston introduced me to CBD or cannabidiol, what we're going to be talking about this evening, I was right on board, even though I didn't know what CBD was at the time. But I have absolutely grown to be an expert in the field of cannabis. On the hemp side and the marijuana side here, I was testifying for the judiciary, in front of the Judiciary Committee, for the legalization and taxation for the adult use law here in Illinois for cannabis. Depression, anxiety has really hit home this week. Some of you may not know, or some of you may know, that not only did my sorority sister, Uella, she committed suicide about 4 years ago, but 2 days ago, my oldest son's best friend committed suicide. And Isaiah honestly was like a son to me. I mean, Isaiah would be at my house all the time. My nanny at the time, when they were small, would pick him up for school too, because his mom is a busy accountant and I'm a busy physician. I mean, we used to really help each other. So just a lot has been going on this week, not only in my life, but in your life, with all that has been happening. And to have Isaiah, you know, take his life as my sorority sister did, I thought that this would be a good topic, because again, we have products that can really assist those who are going through mental illness, But even us, you and I, every single person on this line has gone through depression, has gone through anxiety, has gone through stress. I believe every single person has at one point been clinically depressed at one point in their lives. So when we talk about cannabis, it's important that the guest on our line, Rich, I think is his name, understands that we're not talking about any product that's going to give us a high or a euphoria or a paranoia. We're not talking about marijuana, but we are talking about cannabis. And the cannabis family makes two species. It makes one that gives us the high, marijuana, and one that gives us the health. It gives us the ability to utilize an organic, natural product for depression, for anxiety, for schizophrenia, for bipolar, for major depression, for social anxiety. All of those mental conditions, yes, CBD, cannabidiol, has been helpful, and research has proven that it can help with anxiety and depression. So cannabis has two species. One is marijuana, has a high level of THC, and one is hemp that has a very low amount of THC. That's a part of the plant that gives you the high, the paranoia, the euphoria, and has larger amounts of CBD or cannabidiol. So yes, what we're talking about tonight, all of our products come from the cannabis plant, but comes from the species that does not give you the high, but it gives you the health benefits. So let's look at the health benefits of CBD or cannabidiol. Well, tonight, what are we talking about? We're talking about depression, anxiety. Well, CBD is a compound that has anxiolytic properties. It reduces anxiety. CBD also has a host of other components that it helps with the body, from reducing inflammation and pain, to improving blood pressure and blood sugar, to helping us sleep, to helping reduce muscle spasms in those who have multiple sclerosis, and helping to reduce the contraction of our intestinal tract if we have ulcerative colitis or Crohn's disease. There's over 20,000 peer-reviewed articles alone about CBD and its benefits. There's hundreds and thousands of research, randomized, double-blind controlled studies that have been done on CBD cannabidiol. There's other cannabinoids in the plant that the plant makes that are also beneficial to the body, like CBN and CBG and delta-8 THC and delta-9 THC and THCV. All of these compounds that the plant makes synergistically really affects a positive effect on the body. So CBD or cannabidiol is the #1 compound that the hemp plant makes. And again, hemp gives us the health without the high. And it's legal. In 2018, former President Trump passed the 2018 Farm Bill. And yes, it's an agricultural bill, but it removed hemp from the Schedule I drug classification. So no longer is hemp deemed a dangerous drug, a drug that has a high potential for addiction or safety profile. So in all 50 states, hemp can be grown, it can be cultivated, it can be sold and consumed legally. So when we look at the cannabis plant, your next question I know is, Dr. Rita, well, how does it work in the body? Because as a physician, I want to know how it works in the body. It's not a snake oil, it's not a magical potion. How does CBD help with depression? How does it help with anxiety? How does it help with schizophrenia? How does it help with bipolar? How does it help with all of these mental conditions that we see a lot of these people that have gunned down and killed so many people in the last couple of weeks? How does it work in the body? And it works through the endocannabinoid system. And the endocannabinoid system is a system that's very vital. It's a regulatory system. It regulates and modulates our mood, our sleep-wake cycle, our blood pressure, our pulse rate, our blood sugar, our inflammation, our pain. And it does that by having major receptors in major organs and glands, like the heart, the lung, the liver, the kidney, the spleen, the teeth, the stomach, the skin, the reproductive tract, the central nervous system, the brain. These major receptors, CB1 and CB2, are looking for cannabis when we consume it to put the body in balance. So if we're anxious, if we're depressed, if we're having issues with insomnia, if we're having issues with our blood sugar, our blood pressure, whatever the case is, when we consume cannabis, these receptors bind to the cannabinoid or compound and send signals to the organ or the gland that needs to be put back in balance. And you can see that here. It's like a lock and key sort of system where CBD, THC, those cannabinoids are the keys. And when they bind with the receptors, they unlock and send signals to put the body in balance. So statistics on depression, I don't need to tell you, it's a huge problem. We can see it. Major depressive disorder is a common psychiatric illness affecting 5 to 30% of the population. It's a really, really big problem. We don't have enough psychiatrists or therapists. So we really need to be out there in the forefront, really helping people understand that, yes, CBD sourced from hemp can be used as an absolute alternative and a tool for those who need help. And there's all sorts of types of depression. You know, seasonal affective depression is real. Every time I go to Florida to visit my camp in Florida, I own a gym there. I feel happy. My mood is great. The sunshine, right? And when I come back to the Midwest, it's a real thing. Some people have seasonal depression, affective depression. But when we talk about the causes of depression, there's a lot of different theories about what causes depression. But we know here at Wakana, one big cause of depression, and they've even documented this at the University of Southern California, is what we are eating, right? Just imagine all of the meat and animal protein we are consuming. What we consume, if you're out there and you eat meat, I don't eat meat, I'm a vegan, I'm a raw vegan. You're eating everything that, one, that animal was fed. You're two, eating the fear that animal had when it was slaughtered. And three, you're eating dead corpse, dead muscle, right? So you're not getting the nutrients and vitamins you need. But there is a study, I'm going to share it on our Facebook Live tonight, our Facebook page. There's a study that directly links meat eaters and violence. So we really shouldn't be asking about just gun laws. We should really be finding out what these perpetrators are eating, because what you consume in the meat is the anger, the violence, the fear that that animal had as well. So there's chemical, there's altered brain structures, there's all sorts of theories about depression, but we absolutely can improve those who have mental illness conditions with the type of diet and the food that they're eating. So with depression, you feel down, you feel lethargic, you have aches and pains and changes in appetite and weight, difficulty sleeping. My oldest son's best friend, Isaiah, was a Bill Gates scholar. He was valedictorian of their high school. He was a Bill Gates scholar at Howard University. He graduated magna cum laude. He was an analyst at one of these top accounting firms. And one day he just snapped. Just a normal, brilliant young man just snapped, right? So it's sad. It really is sad, but there's a lot of things that we can do in helping folks with these issues. So depressed versus non-depressed brain, this is an X-ray, a PET scan showing different activity levels. Those that are not depressed has a lot of activity, a lot of bright light and life. In the depressed cells, there's a depressed in energy in those cells of the brain. There's a lot of different types of anxiety. There's social anxiety, right? Those people that get really nervous in speaking in front of folks. There's generalized anxiety. There's phobias, that you have real fears of height or flying. And then there's panic attacks. Anxiety, depression pretty much have the same symptoms, but again, we are going to talk about some products that absolutely can help to address and assist these symptoms. How do you get clinically diagnosed? Blood tests, physical exam, checking thyroid, vitamin, and hormone levels, and really understanding that seeking mental health expertise by a psychologist or a psychiatrist is important. Prozac is a really big medication that we use for depression. In medicine, Zoloft is a medication we use a lot for our pregnant moms that are depressed, but all of these medications have what? Yep, you guessed it, side effects. Many, many side effects are to these medications: dry mouth, insomnia, dizziness, headache, sleepiness, weight gain. You know, my son's best friend absolutely would not take his medication. He said the medication made him feel awful. And he was never able in his right mind to understand how important we were trying to help him with CBD. So these are some of the side effects to many of the medications that we use in medicine for depression and anxiety. Therapies, there's a lot of therapy. Cognitive behavioral interpersonal therapy, group settings, one-on-one settings, and again, there's holistic treatment. I'm all about holistic treatment. I'm all about natural ways of healing the body through exercise, through diet, through light therapy, through CBD, through cannabis. And we're going to talk about specifically how CBD affects in a positive way depression. Well, we talked about the endocannabinoid system, but what is also important, not only does there exist receptors in the brain and the central nervous system, but CBD is able to bind to dopamine and serotonin receptors that are in the brain to release more of these neurotransmitters. See, serotonin is a neurotransmitter that's produced in the brain that controls sleep and appetite and mood and inhibits pain. These are all the symptoms that those who have depression and anxiety have, right? We never want to say that CBD will cure depression, will cure anxiety, but it absolutely will address the symptoms that those who have depression and anxiety. Dopamine is another neurotransmitter. It helps to motivate behavior. So when CBD binds to the dopamine receptors and able to release more dopamine, that person's mood has been improved. So when ingested, CBD compound directly interacts with serotonin and dopamine receptors, really influencing the brain's activity to release these neurotransmitters throughout the body. So CBD acts exactly the same way as Prozac does, and Paxil does, and Zoloft works. CBD has the same effect when we talk about pain as Motrin and Aleve and ibuprofen. These same pathways in the brain and central nervous system, CBD is able to react with through the endocannabinoid system, but guess what? Without the side effects. So if you're on the line, if you know someone who has issues with the depression and anxiety, we all have issues with stress and anxiety and depression. Let's face it, every single one of us, even Dr. Rita, we all do. Some of us are on medication. Some of us are not on medications. I'm not on any medication, but the point I'm trying to make is that we don't want that person to stop taking their Prozac or stop taking their Zoloft or Paxil or Effexor or Lexapro. We want them to talk to their doctor, let their doctor know that, guess what? This is a tool that I want to use. I want to try to reduce or even come off some of these antipsychotic, anti-anxiety, Xanax medications. I've had plenty of friends who have done it. They've worked with their psychiatrist and they have gotten off their medicine very safely, very effectively, and they're on CBD. So yes, CBD can help with depression. There's research that shows that CBD can help with depression. A lot of studies that have been demonstrated in humans and in animals, as well as anxiety. Here are some of the studies. They are right here. I'm not going to go through every one, but utilizing CBD exactly as an anti-stress and antidepressant, but working even better without the side effects. PTSD, can you imagine the children, the other teachers in the school in Texas, what sort of level of PTSD they're going to have? Those in Buffalo, the loved ones. So veterans are not the only people that have PTSD. Anyone that is involved in this horrendous, horrific act will have PTSD. Many of us could have PTSD just watching the news. You know, that's why today, this morning, getting ready for work, had to shut it off. You know, I can only take so much of that. So PTSD is not just for those who are veterans. So there's various ways to consume CBD. There's oral application tinctures, there's edibles, there's gummies, there are vape pens, there's pre-rolls, there's topicals. So we're going to talk about some of these products. These are just slides. These are old slides, guys, right? When we first founded Wakana in 2019, these are the other co-founders, Melissa Boston, our CEO, our president, Dr. Patricia Van Pelt, Phyllis Nash, our Chief Sales Officer. We have different titles now, and myself, Dr. Rita McGuire, Chief Medical Officer. This disclaimer just states that these products have not been approved by the FDA and that you absolutely should talk to your physician about utilizing these medications. If you're pregnant, nursing on medication, again, talk to your physician. Our product line is amazing. And yes, we're talking about depression, anxiety, and a lot of mental illnesses, but these products are used for everything. These products are used for everything. If you have pain, these products are used for pain. You have insomnia, these products are used for insomnia. You have issues with your blood pressure, blood sugar, autoimmune conditions, sexual dysfunction, libido issues, you want to lose weight. These products are used for everything. But what I love about our product line is that we have a product line for those who have random drug screens. So if you're on the line and your employer may do a random drop, we want you to utilize our broad spectrum product, our pure product. That's a product that has less than 0.0% of THC. Now our full spectrum product, our power product, those products are utilized for, forgot my phone. I want to make sure that the ER is not calling me. Our full spectrum product, our power product, utilizes the legal limit of THC, which is 0.3% or less. Again, all of our products are sourced from hemp. They will not get you high. They're not sourced from marijuana. All of our products are tested. All of our products are third-party validated, tested. All of our products come with certificates of analysis to ensure the potency, to ensure the legal limit of THC, and to ensure the product is safe. It doesn't have any mold, mildew, heavy metals, residual solvents, pesticides in our products. So the certificates of analysis show you that. Our products are also registered with the State Department of Agriculture, ensuring that they are from hemp. They are compliant with the 2018 Farm Bill. I reached way back, right? These are some old slides, but this is Wakana, the crown jewel CBD. So we have many potencies of our product line. We have our Hemp MD, which is our most potent product. It's actually 900 milligrams of CBD in a 15 ml bottle. When you start CBD for whatever reason, maybe you're on the line and you want to get some assistance with your gout, or maybe you want to get some assistance with your arthritis, or maybe you're on the line and you just cannot get good sleep. Whatever the reason, these are the products you should be hearing about. Start low and go slow. What that means is start with 3 drops twice a day under the tongue. That's a great starting dose when you're utilizing our tincture. Start low, go slow. If you start with a lot and you rush your body with a lot of CBD, you may have a side effect. It's not major, but it's maybe an excessive fatigue, or maybe you may be a little nauseated. More is not better. Our #1 selling tincture is our Hempranium 500 milligram. It has a proprietary formula. We've enhanced the CBD product with black seed, with peppermint, and with turmeric. A great, great product to start if you're not having as severe conditions where you're not needing a Hemp MD. This is a great starting place. Our water soluble is a great product that you can add in your water. I'm a raw vegan, so I go everywhere, of course, with my juice. So I put some water soluble in my juices that I make. It's great for those people who are on the run. Our culinary, for those bakers out there, you want to bake, you want to cook, you can use our culinary tincture in all of your baked goods as well. Simply put the tincture under the tongue, hold it before you swallow for 60 seconds so that it can be absorbed adequately and efficiently in your bloodstream. Our gummies, we have gummies full spectrum as well as our broad spectrum gummies. We have our Delta 8 gummies. Don't ask me why my laptop is doing this tonight, but our gummies are a great way to address. I like using the gummies before sleep, honestly. 30 minutes to an hour before sleep, I use the gummies. Gummies are going to do the same thing CBD does. It's going to help reduce inflammation and pain. It's going to help with anxiety. I mean, I can go on and on and on and be repetitive, but you understand all of the benefits of CBD. This is just another way of consuming CBD and getting it in your bloodstream. Our pre-rolls give you very fast acting results within 1 to 5 minutes of 1 to 3 pulls on that pre-roll. It's a joint, but it doesn't get you high. It gives you effect because it works fast. It bypasses the stomach. It gets right into that bloodstream. So this is my favorite. Hypnotic, I like peppermint, so it's infused with the peppermint. Also, we have our topicals, our Extreme Power Relief Cream. This is our #1 topical. It comes in a 200 and a 400 milligram. It's also infused with essential oils that help address inflammation and pain. Dr. Rita's Rub is in a roller ball. It used to be, these are really old slides, I'm cracking up. It used to be in a dropper form, but too many people were swallowing it. This is not a product to be swallowed. So now it's in a roller ball. So you know just to roll it on those areas of any discomfort. And again, I just want to point out, if you are undergoing random drug screens, we have a whole pure line in tinctures and gummies for you as well. So we talked about the side effects. If you take too much, there may be extreme fatigue, there may be some diarrhea, there may be some nausea. Don't take too much. The great thing is that nothing will happen to you. Nothing will be severe. You can't even smoke that much marijuana, right, to kill you. No one has died from ingesting too much cannabis ever. So yes, CBD is absolutely a very viable option for depression, for anxiety, for a lot of mental illnesses that we're seeing each and every day. So I think that's all of my slides. I'm going to pick on Rich because I think Rich is our guest tonight, and find out if he has any questions. Is Rich still on the line? You can, yeah, there you are, Rich. You can unmute yourself. You can
Hi.
Take your video off. Do you have some questions for us?
No, Doc, this has been very informative to me, and I'm excited about your presentation tonight. And the information is great, and it's good to know. I know that I was vegan for about 26 years, and I know that lifestyle and enjoy it, and I look forward to going back to it. I started eating salmon a little bit because of it. My the low, what you call the HDL, or it got too high, and so the doctor really recommended that I would do fatty fish. I'm looking forward to trying to be doing the here, and see if I can get back and
Really,
so this as opposed to the same.
You're breaking up a lot, but I think I heard something about, you were breaking up a lot. I think I heard something about your cholesterol being high, and you were using what?
Yes.
Yeah, I think you're breaking
I started,
up.
my doctor recommended that I start doing fish, the salmon. So I do want to go back to the vegan days. I love it.
Absolutely, absolutely. Yes, I think you said I want to go back to the vegan days. I think that's what you said.
So thank you. So absolutely, that's what I want to do. I want to do back in that lifestyle.
Wonderful. Well, let me know if you have any questions about our CBD products. And on Sunday, we're going to invite you to our Flat Belly Zoom webinar. But if you have any further questions about CBD, let me know. I do want to bring up Elizabeth Ann Thompson. If you can unmute yourself, and I need Rich to hear your testimony. Because he heard about our incredible products, but he absolutely needs to hear from a real person that's on the line that has a testimony. And anyone else that wants to give a testimony, you can go after Elizabeth. I would ask that you keep it down to 2 minutes, though.
Well, thank you, Dr. Rita. I came into Wakana about November of 2019, I think. Yes, with Mom Mitchell. And I started, I came to this company because I have been using CBD for 6 months or more from different places, and was unsure about the product. I had some difficulty with my right leg, a lot of pain. It was actually dragging my leg. Within 3 weeks of taking the CBD, Wakana CBD, I was no longer dragging my leg. I have been able to to work out continually without any major distress of any kind. I just rub on some pain cream and our mango body cream. I absolutely love both. And then of course I take a tincture and gummy. So 4 products in general. And then I remember one time having a very, very, very intense headache. I never get headaches in general. But one day I did have a headache, and I was talking to Diana, my friend and co-business partner as well. And she said, well, why don't you just rub some tincture on your head and some of the pain cream? And so I did. And within less than 10 minutes, I no longer had a headache. And I do also want to say that the 21-day cleanse has made a magnificent difference in my life. I'm down about 10 pounds over the last 6 months, and I just feel amazing. I just had my 73rd birthday, and so I'm a very happy critter. Thank y'all.
Wonderful. Happy 73rd birthday to you. I love that, Elizabeth Ann. I'm telling you, this raw vegan life has me feeling like I'm 21. I have so much energy. I had a lot of energy before, but I have even more now. So thank you for that testimony. If there's anyone else that would like to give a testimony, a short testimony, let's unmute your mic. You can come up to the stage here. If not, no worries, but I think if there are other guests on the line, I know Rich is a guest of Gigi Harris. If there are other guests on the line, we want you to connect with the person that invited you here tonight so that you can get your products ordered. You can get any additional questions answered. Every business partner here, I think, knows my email address. So if you need to email me, I'll put it in the chat as well. Rita MD, I am always welcoming any questions, any concerns, any critiques, ritamd@wakana.com. So with that being said, prayers up for all the families in Texas and Buffalo and all around the world. And if you know someone that suffers from anxiety, depression, they're really struggling, they're having a hard time, even on medications, please introduce them to our incredible products. Talk to them about the holistic, that's diet, that's exercise, that is CBD products, that's releasing anger and resentment and unforgiveness. It's holistic. It's not just one thing. It's not just two things. It's so many things that we have to help others with, and even ourselves, right? With unforgiveness and resentment. So with that being said, please connect with the person that invited you. We will see you next week. Thank you for being so patient with me this evening. We had a little technical difficulties, but I really wanted to talk about this topic this evening because of all that is going on. Be well,
Rita?
be safe. Yes.
Dr. Rita?
Yes.
Just before we go, I do have a quick testimonial of a customer who contacted me. She's actually a friend of another business partner, and her daughter, who was just about to graduate high school and had been accepted at University of Southern California in the music program, had, I don't know, it sounded like it was a situational mental health issue, and they wanted to put her on psychotropics, on medication. And she called me, and I recommended our tincture, our hempranium, and the gummies, because the young lady did not want to take medication, and her mom didn't want her to take medication. She purchased everything that I recommended, and this was about a month ago. She called me last night and we had an extensive conversation. Her daughter is doing fine. They had just gone back to the psychiatrist who wanted her to take more medication. And she told the doctor, my daughter said she's not going to take it. And again, she says she's doing fine. She went to her prom. She graduated, and she starts in the music program I guess it would be in the fall. So she was more than pleased. Yeah. So CBD does work, just like Dr. Rita said, for many mental health issues, and diet is also a very integral part of regaining balance. So yeah, always try natural things as far as you can, and save the drugs for as a last resort.
I love that testimony.
Yeah,
That
I was
is
very happy.
powerful. That is
Yes,
so
yes.
powerful. Thank you, Dr. Betty. Thank you for
Thank you.
sharing that testimony, and thank you for sharing Wakana with that family.
But of course.
And I just, encourage all of us to share Wakana with those that we know that are hurting, that are suffering, that are really dealing with a lot of mental conditions and issues. Thank you so much. Have a good night. Be well, be safe, all of you. And again, prayers for those families that have been affected. And please pray for Isaiah's mom and his brother for this devastating loss that they have had as well. So I will see you next week. Be well, be safe, and God bless all of you.
Thank you, Dr. Rita.
Thank you,
Thank
Dr.
you,
Rita.
Elizabeth Ann, for the testimony. And thank you, Rich, for joining.
Pleasure's all mine.
Rich, we'll talk after the call.
Good night.